I encourage the Premier to check his inbox and read the email he received last week from London West resident Kate Reid. Kate's mother was left in a hallway stretcher at University Hospital for 6 hours in acute pain waiting for surgery, along with 11 other patients. 2 patients had been forced to sleep overnight in the hallway with no way to dim the lights. Speaker, how does the Premier think that no longer collecting data on hallway healthcare is going to help patients like Kate's mother and the 2,000 other Ontarians who are being treated in hospital hallways every day?
Minister of Health.
Thank you, Speaker. You know, the member highlights exactly why we are investing in our hospital and our healthcare system. It is precisely those examples, because we have invested in dedicated offload nursing programs to make sure when someone comes into an emergency department, they are quickly assessed and triaged based on their area of need. It is why we have expanded our medical education in every single school across Ontario, including, of course, a brand new medical school in Brampton that has already taken on and coming soon in York Region as well. You know, as we make these expansions, as we enhance and have opportunities for primary care, multidisciplinary teams across Ontario, it really allows us to make sure that not only our hospitals have the support, but also in community. Thank you.
Back to the member for London West.
Speaker, the government's investments are obviously not working because there are double the number of patients sleeping in or being treated in hospital hallways under this government's watch. But, Speaker, it's not just hospital hallways where patients are lining up. Londoners are still waiting months and even years for specialist referrals. Janet Bruce was first referred to a spine specialist in 2022. Almost 4 years later, she is still waiting, still in pain, and still without a specialist appointment. Speaker, why does this Premier think it is acceptable to force Ontarians like Janet Bruce to wait years to access the specialist care they urgently need?
Here, here. Minister of Health.
Thank you. Well, again, Speaker, the member opposite is highlighting exactly why in the budget most recently, a number of weeks ago, we actually had another 4%, over $1 billion to our hospital sector. Why? Because we see that they are an important part of our healthcare system, but they are not the only one. You know, on Friday, I had the opportunity to be at the Humber River Health Center, where we were able to acknowledge an incredible philanthropic gift from the Hennick Family Foundation. And I had a physician come up to me after the announcement and say, thank you for what you are doing in the primary care expansion. It is truly making a difference in our hospitals and making sure that our patients have access to those primary care multidisciplinary teams. Thank you.